Welcome back to First Aid Express. This is Sean Alemi. I'm a resident physician at UCSF in San Francisco, California, in the Department of Otolaryngology. I will be taking you through my final lecture in the microbiology section, and the topic is going to be parasitology. So the term parasites includes protozoa and helminthes, which are also known as worms. Now first we're going to discuss protozoa. Protozoa are unicellular motile eukaryotes. Some have life forms that alternate between a proliferative feeding form called a trophozoite and a dormant form called cysts. Cysts can withstand very harsh conditions such as extreme temperatures and periods without nutrition. The cyst form allows parasites to survive outside of their host and transfer from one host to another when found in feces or water. Over the next several slides, we will go over the protozoa that I think you should know for your exam. The facts are organized by system, and I think this will help you categorize a protozoa and hopefully identify the correct answer on test day. Our first category includes protozoa that affect the GI system by causing diarrhea. Okay, first up is Giardia lamblia, a single-celled parasite. Giardia has a prominent ventral sucking disc. It also has a flagella that provides a characteristic appearance, as you can see in this stained image. You can easily recognize Giardia by the fact that it appears to have a face. So it has two prominent eyes, even maybe a little bit of a smile there. Giardia is happy to see you. Aren't you happy to see Giardia? Here you can see the flagella. The flagellated form is the trophozoite that is found in the body. Here's a higher resolution scanning electron micrograph that shows you the very characteristic mustache and flagellated appearance. Again, here's our mustache, there's our flagella there, allowing this guy to move around. On the previous image, this would have been the eyes that you see, and maybe even a mouth we can see there. You may see either of these images on your exam, so be on the lookout. So what's the typical history that you're going to be given for a patient who's exposed to Giardia? Well, these patients typically ingest Giardia cysts from mountain spring water, so you might suspect it in patients who've gone camping or hiking. Some of these patients, in fact, almost half of them, remain asymptomatic. However, symptomatic disease can range from a self-limited, acute, non-bloody diarrhea to severe chronic diarrhea. And again, the key word here is non-bloody. We'll talk about bloody diarrheas a little bit later. Non-bloody diarrhea. In the small intestine, ingested cysts develop into trophozoites that use their sucking discs to attach themselves to the duodenum and impair duodenal function. Just so we're all on the same page, here on the left you can see an image of a cyst, whereas on the right you see the trophozoite form, which is flagellated. Note that the cyst does not have flagella that we see on the stained image on the right. Now the attachment of these trophozoites leads to fat malabsorption, and this is what causes these greasy stools that we see. Do you remember the term that is used to describe this? The answer is steatorrhea. Great. And what are the signs of steatorrhea? What is your patient going to complain of? The buzzwords that you're going to see in the question will be that this causes a very foul-smelling, greasy stool that often floats because of the high fat content. Treatment, of course, what is it? Metronidazole. Excellent. The next protozoan is Entamoeba histolytica, which causes an infection called amoebiasis. It's spread by cysts in fecally contaminated food or water and causes a bloody diarrhea or liver abscesses that manifest with right upper quadrant pain. So remember we said Giardia was a non-bloody diarrhea. I'm going to write NBD, no big deal, but it's non-bloody diarrhea. And Entamoeba histolytica causes a bloody diarrhea, which seems like a much bigger deal, right? Excellent. Okay, so entamoeba is capable of ingesting red blood cells. Therefore, it may be possible to see these RBCs within the cytoplasm of the parasite. Here you can see 3 entamoeba organisms. What are these dark circles here? These are the ingested red blood cells that appear within the cytoplasm. Remembering that entamoeba ingests RBCs may help you to recall that this protozoa causes bloody diarrhea, also known as dysentery. Entamoeba can also cause single or multiple abscesses in the liver by penetrating into portal vessels and entering the liver. The abscesses are filled with acellular proteinaceous debris and trophozoites which have a reddish-brown appearance, often likened to an anchovy paste as it is composed of homogenized liver cells. Because of this, these are often referred to as anchovy paste liver abscesses. Keep this type of liver abscess in mind because the treatment here is going to be much different than some of the other liver abscesses we'll discuss shortly. Entamoeba can also produce ulcers in the colon. These ulcers are described as having a very characteristic appearance. Can you remember the name of that term? They're described as having a flask-shaped appearance because of the narrow neck and broad base, almost like an Erlenmeyer flask from your organic chemistry days. And you can see that here in this image. Note the narrow opening and the broad base, just like your Erlenmeyer flask. Treatment is going to be iodoquinol with the addition of metronidazole. Cryptosporidium is a protozoa causing watery diarrhea, and it is transmitted by cysts in fecally contaminated water supplies. There's something very special about how this organism is stained. Can you tell me what this special staining property is? It's weakly acid-fast. Excellent. Here is an acid-fast stain showing the cysts in red. In immunocompromised hosts, such as an AIDS patient, this diarrhea can be very severe, unrelenting, and in fact life-threatening. In immunocompetent hosts, on the other hand, the diarrhea is usually self-limited and mild. Filter treatments of water sources is important in preventing cryptosporidiosis. There is one medication for treatment. Can you remember it? The answer is nitazoxanide. Okay, let's quickly review the difference between the diarrheas caused by these three organisms. Fatty diarrhea, Giardia. Watery diarrhea, Cryptosporidium. And bloody diarrhea, Entamoeba histolytica. Excellent job. Okay, let's move on to protozoa causing CNS infections. You may recall from your reproductive pathology that there are several organisms that can cross the placenta and cause congenital infections. Question: do you remember the acronym frequently used to describe these? The answer I'm looking for is TORCHES. The T in TORCHES is for Toxoplasma gondii. Can you recall the triad of congenital toxo that is classically described? Well, these neonates will usually have findings of chorioretinitis as well as hydrocephalus and intracranial calcifications. Here you can see what chorioretinitis looks like. It's an inflammation of the choroid. And what animal is usually the culprit carrier? The answer, cats. This is why pregnant women should avoid house cats, whose feces will often carry the cyst form of Toxoplasma gondii. Here's a section of brain tissue showing a cyst. It's pretty tough to identify on its own, so if you see this image on your exam, you'll probably be given a classic history of toxo as well, and that's what you're going to use to make your diagnosis. Also, watch out for toxoplasmosis infections in HIV patients who will present with what finding? Brain abscesses. Very good. Remember the phrase ring-enhancing lesions, which are buzzwords used to describe how toxoplasmosis abscesses appear on CT and MRI. Here you can see a very nice example of a ring-enhancing lesion. Remember, you can use contrast on CT scans to light up things like infectious processes. Treat with sulfadiazine and pyrimethamine. By the way, just as a general question, let's tie in some neurology here. Somebody with a brain abscess, what kind of symptoms do you expect them to have when they present? Well, these are non-specific findings, and they're not going to tell you what exactly is going on, but most patients will have alterations in their mental status. They might be confused. They may not know their name, what time it is, where they are. These are red flag signs, guys. What else? Well, they're going to have headaches probably. They might have fevers because they have an infection, and they may have very specific neurological deficits. Maybe they're going to have weakness. They may have sensory abnormalities. They may have cranial nerve deficits. And all of these deficits are going to depend on where that lesion exactly is. So when you see these types of neurological findings described to you in the question stem, start thinking maybe there's something going on in the central nervous system. Naegleria fowleri causes a fatal meningoencephalitis. Can you tell me the classic mechanism of transmission? These patients are usually described as having recently been swimming in a fresh body of water. So, Naegleria enters through the nose and it goes through the anterior skull base through a small opening. Now, remember what that plate's called? It's called the cribriform plate, and it enters into the brain. Remember that the cribriform plate is like a cheese grater, has many small holes that permit the passage of certain nerve rootlets. Can you remember which cranial nerve is passing through? The answer is the olfactory nerve, or cranial nerve 1. Now, Naegleria is going to enter the cranial vault through these openings and encyst within the brain. These cysts are then going to cause all the other side effects and sequelae of the disease. Here's an H&E slide of the brain showing the cysts within the brain. Patients will present with typical signs and symptoms of meningoencephalitis. Can you list a few? Well, we just talked about some of them on the previous slide. I'm thinking headaches, fever, but here they might have some nuchal rigidity, possibly even mental status changes. So nuchal rigidity is actually a sign of involvement of the meninges, whereas the other signs are more kind of non-specific signs of central nervous system involvement. Unfortunately, there's no treatment for this devastating infection, but the literature shows that amphotericin has been effective in a few survivors when used early. African sleeping sickness is caused by the protozoa Trypanosoma brucei, which includes two subspecies, Trypanosoma gambiense and Trypanosoma rhodesiense. Here's a peripheral smear showing the parasites within the blood. Rhodesia is the former name of Zimbabwe. It might help you remember it, but this form manifests much more quickly and is far more serious. In African sleeping sickness, or African trypanosomiasis as it is often called, the protozoan invades the lymphatic system, causing enlarged lymph nodes, which are often tremendous in size. Recurring fever due to antigenic variation of the Trypanosoma species is also seen. If you leave it untreated, the infection can enter a second phase characterized by severe somnolence, fatigue, and even coma due to its effect on the central nervous system. The specific part would be the locus coeruleus. Therefore, remember, this protozoan causes sleeping sickness and is endemic to sub-Saharan Africa. Trypanosoma brucei is transmitted by the tsetse fly, which is known for its painful bite. Ceramin and melarsoprol are used for blood and CNS diseases, respectively. Time for another flash quiz. Name 3 protozoa that cause infectious diarrhea. The answers are Giardia, which causes a fatty, greasy diarrhea, Entamoeba histolytica, which causes bloody diarrhea and flask-shaped ulcers, and Cryptosporidium, which causes watery diarrhea. The 2 protozoa causing hematologic infections are Plasmodium and Babesia. Members of the Plasmodium genus, P. vivax, P. ovale, P. malaria, and P. falciparum, are the causes of malaria, a mosquito-borne infection, widespread in tropical regions such as Asia and Africa. Malaria is characterized by cyclic fevers, headache, anemia, and splenomegaly. How often the cyclic fever appears is often related to which Plasmodium species is involved. P. vivax and ovale typically cause fever every 2 days, aka tertian fever. P. malaria causes fever every 3 days, aka quartan fever. Finally, P. falciparum has a severe irregular fever that can often occur almost every day as a continuous fever. P. vivax and ovale are unique in that there is a dormant form of the parasite known as a hypnozoite, and this can hide out in the liver and reactivate in the patient at a later time. Therefore, you must add primaquine to your antibiotic regimen when specifically treating for P. vivax or P. ovale to target these dormant forms. Remember that P. falciparum is the most severe malarial infection because it can affect red cells at all states of their development. These infected cells can then obstruct the capillaries of the brain, a phenomenon known as cerebral malaria. They can also affect the kidneys, which is known as blackwater fever, and even the lungs. Plasmodium has a life cycle which involves the liver and blood and is illustrated in this figure. First, an Anopheles mosquito transmits Plasmodium to a human when it takes blood from the human host. The sporozoites then enter the bloodstream and travel to the liver where they in fact are going to infect hepatocytes. The sporozoites will spend some time there, multiplying into merozoites until they eventually rupture in the hepatocytes and escape into the blood. The merozoites are now able to infect red blood cells where they develop into ring forms known as trophozoites and schizonts. Sexual forms known as gametocytes are also produced, which can continue the life cycle when taken up by another mosquito during a blood meal. Plasmodium infections are diagnosed by examination of blood smears, looking for the classic ring form of the Plasmodium trophozoite, which I'll show you in a second. Here's a nice image of a ringed trophozoite of Plasmodium ovale. Nice big arrow to help you find what you're looking for. You might not see this on your test day, but hopefully you will see this. Here's another image with a similar finding. Remember that merozoites affect red blood cells and develop into this ringed form. Blood smear can also show the mature schizont form of Plasmodium. These images show a Plasmodium vivax schizont containing several merozoites. Here it is right there, and there it is right there. Here's an image showing the banana shape or crescent form of the gametocytes of Plasmodium falciparum. Chloroquine is the first-line agent for treatment of uncomplicated malaria caused by non-falciparum species that are chloroquine sensitive. Malaria prophylaxis is also advised for people traveling to malaria-endemic regions. These patients are usually given mefloquine or primaquine. And you can, of course, look this up on the CDC website before you travel somewhere. The next protozoa that causes hematologic infection is Babesia. It's transmitted by the Ixodes tick. Do you remember what other organism is transmitted by the same tick? That would be Borrelia burgdorferi. And what did this cause? It causes Lyme disease. Did you remember what the classification of this type of bug is? What is it known as? It's a spirochete, and it's possible for patients to become infected by both Borrelia and Babesia from the same bite. But in babesiosis, expect to see fever and hemolytic anemia. Similar to malaria, diagnosis is made by doing a blood smear. Do you remember the classic finding that is diagnostic of babesiosis? This smear shows the Maltese cross form of the organism within the red blood cell. The Maltese cross is formed by 4 merozoites asexually budding but attached together to form a cross-like structure. The Maltese cross shape is also seen in the fatty cholesterol casts of a certain type of kidney disease. Can you remember that? It's nephrotic syndrome. For more information, take a look at the nephrology section. You may also see the ring form of Babesia within red blood cells, which can sometimes be confused with Plasmodium. Treatment for this infection is with quinine plus clindamycin or atovaquone with azithromycin. Protozoa causing visceral infections are next, which include Trypanosoma cruzi and Leishmania donovani. Trypanosoma cruzi, seen here, is endemic to South America and causes Chagas disease. This is a disease characterized by dilated cardiomyopathy, megacolon, and megaesophagus. Hey, do you remember what other esophageal disorder it can cause? Let's say you have a patient who has dysphagia for solids and vomits undigested food. You, being the smart medical student that you are, recommend that your team orders a barium swallow study, and you see this. What's the disorder I'm describing? This is achalasia. And what is the term applied to the main finding in this barium swallow study? Well, you have esophageal dilation here, sometimes that's known as megaesophagus, and then you have this tapering distally, and sometimes that's described as having a bird's beak appearance. You can see there it comes to a tapered point, somewhat similar to a bird's beak. You'll learn more about this in the gastrointestinal section. Trypanosoma cruzi is transmitted by the reduvid bug, which has a painless bite. Sometimes it's also known as the kissing bug. Kisses should be painless, right? Remember, we just said that Trypanosoma brucei is transmitted by the tsetse fly, which has what kind of bite? That would be a painful bite. Treat Trypanosoma cruzi with nifurtimox, which is a drug that has activity against the trypomastigotes and amastigotes of T. cruzi. The second protozoa that causes visceral infections is Leishmania donovani. Although a cutaneous form of Leishmania is more common and manifests as hyperpigmented skin lesions, you should know that the visceral form of leishmaniasis is more severe and deadly. This occurs when Leishmania donovani moves to organs such as the liver, the spleen, and bone marrow, and if left untreated will result in death of the host. Typical symptoms include spiking fevers, hepatomegaly, and pancytopenia. This image shows Leishmania donovani as amastigotes in the cytoplasm of a blood cell. The protozoan is transmitted by the sandfly, and diagnosis is made by directly visualizing amastigotes in splenic or bone marrow aspirate. Treat this with sodium stibogluconate. Finally, Trichomonas vaginalis, which causes a sexually transmitted disease. Here's a smear showing trichomonads, which cause vaginitis characterized by foul-smelling, frothy green discharge, itching, and burning. And what are you going to see on cervical exam here? The cervix is usually described in these patients as having a quote-unquote strawberry red appearance because of the inflammation. Now don't confuse this one with Gardnerella vaginalis, the gram variable bacteria that causes vaginosis, osis not itis. And this is characterized by foul discharge, which is usually described as being gray and fishy smelling, as opposed to frothy green, which we see in Trichomonas. Do you remember what you see under the microscope when you look at a KOH prep taken from a patient with bacterial vaginosis? You see clue cells, seen right here. Clue cells. Now, one other thing. Is Gardnerella technically a sexually transmitted infection? It is not, and this also helps differentiate it from Trichomonas, a protozoan that cannot survive outside of human hosts because it does not form cysts. You can diagnose Trichomonas if you see moving trophozoites on wet mount of the vaginal discharge. Conveniently, both Gardnerella and Trichomonas can be treated with metronidazole, but remember that in Trichomonas, you have to treat the partner as well. Time for another flash quiz. What esophageal disorder is caused by Trypanosoma cruzi? And what is the appearance on barium swallow? Well, the answer is achalasia, and this causes the dilated esophagus proximally with the bird's beak appearance distally. This is a very common image that shows up on the USMLE Step 1, so make sure you commit this one to memory.